cloud. We are recording to the cloud. All right. As we welcome everybody into this space, I'd like to welcome everybody again to another talk for the TAM Fam Jam, as I like to call it. Today, we're going to be talking a little bit about psychedelic use, preparation, and integration with Dr. Sienknecht, also likes to be called Eric. We are also having some wonderful art being done by our friend Unicorn Face, Emily Ruth, and some amazing ASL by Andy, who, if you guys remember from the Psilocybin Summit, was amazing then and is welcoming. We are welcome to have her back here today. I am your moderator, Ian Bollinger. I am an entheogen researcher and friend of the summit. Huge fan of everything that's going on here. So I don't want to take up too much space. There's a lot to do. Doctor, would you like to take over?
Happy to. Just noticing in the chat, someone says that they can't see me. I just wanted to make sure everyone can.
Okay. Add spotlight. Better?
I don't know, but hopefully.
Yes. Okay. Cool.
Oh, cool. Awesome
possum.
Well, welcome everyone to this talk. And my name is Dr. Eric Sienknecht. I'm a clinical psychologist. I also work, I'm a co-founder of Polaris Insight Center, a ketamine-assisted psychotherapy center in San Francisco. We have a clinic where we provide treatment. We also do trainings of clinicians who are interested in doing this work and providing this treatment for their patients. We hope to eventually have retreats open to people interested in doing deeper personal work with the medicine. And I'm also a sub-investigator and therapist on the MAPS clinical trials for treatment of PTSD with MDMA. So I work with MDMA and ketamine pretty regularly, and basically make a living guiding psychedelic journeys for people. It's pretty awesome to be able to do this work, and yeah, I'm as I mentioned in the introductory talk, I'm also a longtime psychonaut, and so my approach to the work is also informed by my own personal experiences of preparation, integration, and just ever seeking to understand better my psychedelic experiences and myself.
If I may, actually, in that space, that's something that you're offering to other people here. That's a lot of what your work is based around. Could you maybe talk about how you're tying your passion to your work a little bit?
Yeah. Well, that's what my talk is about, is just, my passion for really educating people, my patients, the public, on the importance of creating a good container for the experience and how do you do that. And I have a particular passion for music and the interplay and synergy of music and medicine, and the intricacies of that work, depending on the medicine you're using, changing the playlist and arranging the tracks and choosing the right tracks for specific medicine work. And I'm developing a music module with Polaris Insight Center that I'll be offering later in the year. I'm really excited about that. And so that's a passion of mine.
So with Polaris, you're working specifically with ketamine. So you're making a playlist for that space, but you'd also mentioned you're working with MAPS. So you're saying you would be developing a different playlist for the MDMA space that you might be working with in the ketamine.
Yeah, different playlists for ketamine may not sound so great in the influence of MDMA and vice versa. Yeah, so it's really specific to the medicine. Mhm.
And is that what you mean by containers in that way? That's one aspect of it.
That's one aspect of it. The music is a carrier wave that carries people through the journeys, tells a story, beginning, middle, and end. And so, yeah, kind of creating a story through the music is really exciting.
That like through line thread of narrative.
Exactly. Exactly. So, yeah, I'll go ahead and jump into my presentation, and I have a PowerPoint here. Hopefully this will work. Ian, let me know if it looks good. Let's see. Is that visible?
I do not see your screen right now.
Oh, you don't? Okay.
So you should be able to share. And let me see if I can't. Do you have an option to share screen? You should.
Oh, yeah. Okay, cool. Sorry.
You're good.
Share. Oh, wait. No. I need to share through Zoom.
Yes, sir. Yes, sir. Yes, sir. I think we're getting there.
Is that popping up? Okay.
Now, here's a quick question. Can everybody still see our interpreter as well? We cannot see. Okay, so give me 1 second. Let me unpin, remove that one, and remove spotlight. So now let me spotlight for everyone. Now can we maybe see Andy? Cool, now we're good.
All right. Okay, so Polaris Insight Center is where I work, and I'm co-founder of the clinic. We have trainings. You can learn more about our center, polarisinsight.com. And I want to say that my talk is kind of oriented around, well, it's around my clinical experiences with providing this treatment to people coming to our clinic for treatment, for healing.
Mm.
And so it's through that particular lens that I'll be kind of sharing this info. Before I jump in, I just want to pay homage to my late dear friend Rishi. His birth name is Kareem Gargour. He's a Jordanian American guy that I met in an indigenous medicine class at California Institute of Integral Studies, and in 2009, and developed a deep and lasting friendship. And it's within the context of our friendship that I was able to go deeper into my spiritual practice with the medicines, and to feel contained and understood by someone. So the friendship was really important in my ongoing integration. Our integrations would be look like getting together on a Sunday afternoon on his porch and just talking and sharing about our experiences with the medicine, and learned so much from him. He's also a DJ and musician, and really taught me how to really deeply listen to music and develop a relationship with music. So thank you, Rishi. So just an initial thought about preparation that, I hear a lot, people kind of blaming lack of integration, blaming challenging, difficult post-journey experiences on lack of integration. He's not integrated enough. She hasn't done enough integration work. And oftentimes that's true, and that's the case. And there's a really important place for integration, and that's why we're here this weekend. But sometimes overlooked is the importance of preparation, the responsibility of the individual participant in the experience to do their research and check in with themselves, understand their intentions, creating a safe set and setting, and the responsibility of the guide or the therapist, if there is a guide in the journey, to educate, prepare, support, and do good preparation.
Mm.
So this is one of our treatment rooms. This is a kind of mock MDMA therapy session. There's a co-therapist. There's two therapists in the room at all times with the patient. The patient is in a comfortable setting, eye shades and headphones, and is on a journey. This is one of our rooms at Polaris Insight Center. I'll just show you also, let's see. So some elements, I'm just going to talk about setting for a minute here. We want to kind of create an aesthetically pleasing container, room for the patient to have an experience. There's a nice decoration, maybe spiritual or visionary art. The patient has headphones or is listening to an external speaker. There's eye shades to direct the patient's attention within and to minimize distractions. There's music playing pretty much the whole time for MDMA. And so I develop 8-hour playlists for MDMA work. And with ketamine, because the experience is much shorter, hour and a half, 2-hour playlists. We also have sage and Palo Santo in the clinic that we will burn before the session to clear the energy and create a nice fragrant ambiance. And we also have medicine cards, which is of course optional, but some people like to draw a card before the experience that has particular mythical, archetypal, spiritual meanings, and that can add an extra dimension of meaning to the experience.
So on that, there's actually a question about that. Is that a specific thing, or is it whatever is pertinent for the individual? As far as like the deck itself, like I can imagine one person might bring in a tarot deck and another might bring in a visionary deck.
Sure, yeah. I mean, I always talk with the patient about that and see if invite them to bring their own deck if they like. We have many decks at the clinic that they could choose from as well.
Oh, okay, cool.
Yeah.
Could you maybe give an example of a card or something that you've seen come up?
Yeah. Yeah, just there's one deck is I think a druid animal card deck, and so different animals representing different qualities or archetypal dimensions. So I was in a session the other day, and the patient drew a crow,
Ooh.
a symbol of initiation and healing. And I read the meaning to her, and she resonated with it. It just so happened it was also her first ketamine experience. So actually was kind of like, really
synced up,
synergized with her process and where she was. It kind of was quite profound.
Cool. There's more questions about these, but we'll probably get into those later. Thank you. Sure,
yeah. So just a couple of pictures of our clinic in San Francisco. This is the Castro district. We have the first 2 floors of this building. The bottom floor is used for the MDMA clinical trials, as well as our ketamine sessions. This is kind of just a few pictures of the inside of our clinic. It's warm, it's comfortable, kind of living room-like setting. Does not really, it's kind of the opposite of a sterile medical office, in a hospital. It's inviting and it's comfortable. This is one of our treatment rooms. We have an Amanda Sage painting there on the wall. More treatment rooms. Okay, so I'd like to talk a little bit. I want to talk about preparation, but I want to just talk about it in the context of these kind of three broader paradigms of healing. This is taken from Raquel Bennett's article in the MAPS newsletter, I think last year. Great little piece, and just kind of really speaking to the different paradigms in which people approach this work. The medical paradigm is one that most of us are familiar with, really focusing on the biological and neurochemical effects of the medicine, and really, using objective measures and testing to determine and kind of like gauge progress. And there's certainly a place for the medical paradigm in this work, but it can also be narrowing and limiting. As I've gone along in my work, I've really realized the different levels of healing that happen that really require a broader, more expansive and integrative understanding. And so we have the psychological paradigm, which is, really the emphasis is on the relationship between the therapist and the patient as a kind of container for the work. The importance of set and setting, the importance of preparation and integration. There are IV infusion clinics in the Bay Area that, and all around the growing IV ketamine infusion centers that most of them don't have psychologically trained staff that provide preparation integration sessions. And not to knock IV clinics, there's glad we have them, there's a place for them, but I really am a firm believer and advocate of working with psychologically trained staff when you're providing this work clinically. And then the shamanic paradigm is this way of holding the work and approaching the work that really understands the healing potential of non-ordinary states of consciousness, and recognizes that the induction of trance with the use of medicine and music and dance is one of the oldest forms of medicine, one of the oldest forms of healing. And so understanding the various transpersonal experiences that arise in psychedelic experiences is really important to understand, both intellectually, academically, but I believe also experientially. So I'm a firm believer of the clinician having their own experience with the medicine that they're providing, if possible, and not everyone can do that. And so that presents a set of problems in itself, access and cost, and all of these things. But if you can, if it's possible, clinicians should really pursue their own personal experiences with the medicine, and really not only to know what their patient is going through in the experience, but also to do their own personal work and to continue to work on themselves. Psychedelics may not be their path, but psychedelics do provide this opportunity to understand oneself better and see one's blind spots and biases. And I'm going to talk about preparation from each paradigm. In each paradigm, in the medical paradigm, with all patients coming into the clinic, we do a medical screening. Maybe with one of our psychiatrists. Some red, yellow flags are history of psychosis, active mania, chronic active substance abuse. And that's not to say that these people can't benefit from using psychedelics, but more research needs to be done on how these people can be helped, and what kind of additional support and container they might need to be able to move through the experience successfully and have benefit from it. The psychiatrist does a history review of their any medical illnesses and their history of treatments. They review the medications that the person is taking, and takes on the tapering off of medications as needed. For the MDMA study, we have anyone who's on the SSRI to taper off of that before taking the MDMA, due to the risk of serotonin syndrome. Also, seems to be some blunting effect of the SSRIs on the psychedelic experience. So we want them to be clean and clear and be able to get the optimal benefits. Sometimes testing is needed, particularly in the MDMA trial. People with heart, liver, kidney disease, history of those conditions need to get maybe extra cardiovascular testing and blood work. And then, I think it's also the role of the physician to just educate the patient about the neurochemical effects of the specific medicine they're working with. What neurotransmitter systems affect it? How does it affect the brain? Oftentimes, research is showing more and more that psychedelic medicines can increase neuroplasticity and synaptogenesis, leading to greater connectivity between brain regions and greater functionality overall. For example, MDMA has this magical effect of reducing the activity in the amygdala, the fear response center of the brain, while increasing activity in the prefrontal cortex, where discursive thought takes place, so that we're able to think more clearly, and then greater access to the traumatic memories which are stored in the hippocampus. So all of those three effects combined lead to like the perfect medicine for processing trauma and potentially resolving trauma. Many psychedelic medicines also decrease activity in the default mode network, which is the center of the brain that is responsible for, it's a network of brain regions associated with one's sense of self and perpetuating one's sense of self. And so there's a decreased activity in that area, then one has a lessened sense of their normal self and a sense of so one sense of self shifts in response. So educating them about that, more to say there, but and then assessing risks and benefits. Okay, so that's the medical paradigm. Preparation from the psychological paradigm, the emphasis is on establishing therapeutic alliance, communicating at all times as much as possible, empathic presence. Discussing our approach to the work, which is non-directive or inner-directive. So we're not, we don't have a manualized approach to how the process will go. It's really more open-ended and led by the patient and the patient's inner healing intelligence. I'll say a little bit more about that in a minute. In the preparation phase, I explored the client's relationship with the mental health system. Unfortunately, we have a really broken mental health system, and a lot of people have had really, at best, unhelpful experiences in treatment, and at worst, traumatizing experiences in treatment. So really exploring and validating their distress associated with past treatment, and maybe their distrust of providers and of the system in general. Exploring their motivation to engage in the process. So where are they in terms of, what do they think about healing? Is healing something that's possible? Have they done some healing work on themselves already? Are they resistant to it? Are they suspicious? Really just kind of exploring and validating their relationship to their own process. What is the client's relationships with substances, including psychotropic medications? Many people have, some people have been helped by psychotropic medications. There's a place for them. Many people have not been helped. Statistic is like 25 to 50% of people don't respond to SSRIs. So validating that, and then, you know, exploring their past psychedelic substances, psychedelic experiences. Have they had trouble letting go? How much of that was due to poor poor set and setting? How much of that was their own defensive structures that were keeping them from really surrendering to the experience? Have they had good experiences with the medicine? What were those like? Have they had experiences with non-ordinary states of consciousness? So you're just asking a lot of questions in the preparation sessions. And then also want to take a trauma history. What have they have abuse or neglect or trauma in their past, and, you know, letting them know that that can come up in the session, and there's a chance to really have access to unresolved traumatic memories, and to heal them through living through them, and potentially, ideally, having access to a range of emotions associated with them, so that they can express what they need to express, and release what they need to release around the trauma, and to understand what they need to understand. We want to assess their social support. Are they relatively isolated? Do they have family? What are their relationships with their family? What's their support system like? And then, excuse me.
Oh, no, take as many sips as you need. This is very, very deep and important information.
Thank you. And then, you know, we want to, you know, I'm interested in, like, who is this person coming in for treatment? What are their personal beliefs about using psychedelics for healing? And, you know, we get all sorts of people in our clinic, from people who are psychedelic naive and have never taken a psychedelic, but they've tried so many treatments that have not worked, and that they're willing to, you know, maybe they've read Michael Pollan's book, but they're willing to, you know, like take this leap into psychedelic medicine because they don't really have many other options. And then we have, you know, seasoned psychonauts coming to our clinic who are very familiar with navigating the psychedelic experience, and, you know, are true believers, so to speak. They believe in the potential of the medicine, and but they want to have a clinical experience of what the medicine is like. They for whatever reason, they want greater holding or support, or in doing their personal work. Identifying the patient's goals and talking about that, and developing a treatment plan that addresses them. We do intentions, intention setting. There's a paradox here in this work, that we ask people to have intentions about the work, and to really kind of spend time journaling, talking with others, introspecting on why they're seeking this deeper level of healing, and to get clear on that before taking the medicine. At the same time, we also ask them on the day of the medicine session to let go of expectations, that to trust the medicine, to trust the process, to trust their own inner healing intelligence, that whatever comes up is what's meant to come up. It's coming up for a reason, coming up for healing. And no matter how distressing or challenging it is, that trusting that it's coming up to be understood and to be worked with. We talk about beginner's mind. So this is from Shinryo Suzuki, a Zen teacher, founder of the San Francisco San Francisco Zen Center. And he says, in the beginner's mind, there are many possibilities. In the expert's mind, there are few. So we want to like cultivate, promote beginner's mind, both in the patient and in the therapist. We don't know how this process is going to unfold. We don't want to shape it with certain expectations or agendas. And then I also talk about therapeutic touch, you know, making explicit that there will be no sexual touch or contact in any way during the treatment, just to ensure that they, you know, just to for safety, that the patient knows that it's clear and explicit. In terms of like therapeutic touch, discussion around how they feel about therapeutic touch, a hand holding or a hand on the shoulder, or and really kind of just having conversation about that. And of course, it should be made explicit that no touch will occur without the patient's explicit consent. So, and then also, just want to say that I think it's the preparation phase is an opportunity for therapists, facilitators, guides to really do some priming. And so, you know, when I talk about the medicine, I get excited because I just I'm just excited about it. It's so powerful. And so like, I'll take the opportunity to, you know, talk about the different kinds of experiences that people have with ketamine, for example, a sense of spaciousness, being safe in one's own mind, a chance to wander and discover without intrusion, without threat. connection with oneself, a sense of core goodness. People experience a deep peace. People have said, you know, I just didn't have a lot of visuals or insights, but I just had some deep, deep rest. And that was so needed, you know. So
For the overstimulated world we live in.
yeah, yeah. I've had sorry, keep doing that. I've had fantasies of, well, yeah, ketamine retreats and being able to provide a place for people to come and do some deep rest work. So, and then I've heard people say, you know, everything feels like it's in its right place. And there's a sense of like elegance to that. Like there's nothing needed from you. You're fully safe and supported. You can let go and surrender and trust and appreciate. So there's an elegance to that. There's also talk about it as an opportunity for time out from depressed mind or anxious mind. This is inspired by Phil Wolfson, who's a leading pioneer in the ketamine-assisted psychotherapy. Perspective, people have a sense of their observing self or witness consciousness, that there's a quality of that state of consciousness where one is removed from one's usual conditioning and conditioned mind, and can kind of see the depressed thoughts and the depressed feelings and that those old narratives, but can see them from without, and realize that, you know, they are not that is part of the content of their psychic space and their psychic life, but it's not who they actually are, because who they actually are is this observing self. It's not that. It's not this, not that. It's something vaster, something more expansive. I talk about ketamine as a chance to experience the materiality of consciousness, the textured, vibrational quality of consciousness itself. And this, of course, is facilitated through the use of music, so that there's a way in which various vibrations and perturbations of the music can reveal to us the dimensions of a consciousness. And I know that sounds mysterious, but it's kind of one of those things that it's just really hard to put words to.
Oh no, I'm gonna have some questions about the texture of the universe for you later.
Okay, yeah, I'll get ready for that one. And it's also a chance to appreciate the beauty of music. I was just tuned in to a talk before this, and I heard Susanna Bustos talking about sonic identity, which is such an interesting idea, and experientially really resonates. And I've heard people describe this expansive state of consciousness where they feel like they become the music itself. And that, and then I like to say also, always prime people on the day of the experience to have a clean diet. We ask people to fast for 4 hours before taking ketamine, and for, I think it's more like 12 hours before taking MDMA.
Okay.
And to, you know, exercise or do something physical if possible. Yoga practice is a really great way to prepare. I talk about priming the visual cortex. So take some time to connect with nature or connect with beauty in some way. Maybe it's an art book, but you're kind of like priming the visual cortex so that when you are in the experience that you have actually just greater access to like beautiful images or beautiful experiences that you've just recently had. And then we have people to clear their schedule for the day so they don't have any pressing needs that can intrude into the experience. That's obvious, but worth
saying.
Explicit.
Yeah. Absolutely explicit.
I know it's a lot of information. Oh, God. Oh wait. Okay, so another 10 minutes. So then just we'll talk about the shamanic paradigm here quickly. And I talk about the healing process as opposed to cure, which is largely a myth for most treatments. There's a few exceptions, but healing is an active process. So it requires conscious engagement on the part of the client. It's not a passive procedure that they're coming to receive and not have any kind of engagement with. It's also not talk therapy.
Hold on 1 second. We're having an internet issue.
I think
Could you go back to something right quick? Can you go back to the talk therapy?
Sure. Can you hear me now?
Yes.
Okay, cool. Sometimes people go to talk therapy and sometimes people come to therapy for me and with me, and it's clear that they don't really want to change anything in their lives. They kind of want to keep things the same, and they're coming to therapy so that they can say that they're coming to therapy. They can tell themselves, well, I'm doing something, but they're not really actually invested in real change.
Passively.
You can't really do that. Yeah, you can't do that with psychedelic medicine. You really requires a certain commitment and readiness to change, which is good news. It's also healing is also a very personal experience. Each healing process is unique and individual. And then just an emphasis on process, that there's no end point to healing. I've never met anyone who's fully healed, not that I know of. Maybe there are people, but healing is kind of an ongoing process of continual learning, growing, letting go. Okay, the inner healing intelligence, really seeding this in the patient's mind that you do have a capacity to heal and move towards wholeness, and that this is a process that's largely intuitive and spontaneous and not rational, not logical. And so really we're creating the good conditions for the inner healing intelligence to emerge and go where it needs to go in order to heal and move towards wholeness. And then just reminding people that healing through non-ordinary states of consciousness is really the oldest form of medicine. And, just speaking to various transpersonal experiences that can happen, out-of-body experiences, near-death experiences, remote viewing, identification with plants and animals, mystical experiences, really kind of speaking to these things and kind of answering people's questions about them. Okay, so
if you want to, we do have a number of questions. How much more information do you want to go over from your slide deck?
Yeah, I think let me just take another couple minutes and finish here, and then I'll open it up to questions. Yes, so sorry, I didn't really time this talk very well. Let's see. Okay. Yeah, and I'm happy to actually make these slides available publicly.
There has been a request, and Daniel said we'll work with you to get that out.
Yeah, totally. Okay, so sorry about that, guys. There's more information, but yeah, you know what? I will just end it there. I'm more curious in your questions and having dialogue. So let's end there. And thank you for your attention.
There is that extra added bonus as well. You want to mingle afterwards. There's an opportunity in the orzo little hallway area, and there's a lot of opportunity to engage there as well. There, if you'd like to, though, I would like to touch on at least the topics that you were going to talk about. Psychoeducation is a big one, and I
Yeah,
think education is something that this is what the Tam Fam Jam does best: is connect people to educators like yourself.
yeah, yeah, yeah. Yeah, so I think the therapist or guide or facilitator should really have awareness of the specific effects of the medicine, the course of the medicine effects, when when the onset is, when the peak is, and the dose ranges, and really being able to give someone a good picture of what kinds of experience comes with what level of dosing, and kind of like fine tuning kind of what the patient is looking for and which doses are going to be most effective for that. And of course, the patient is in consultation with the psychiatrist who's really making these decisions. But it's also important for the therapist to have that knowledge as well. And I think, I always mention that that psychedelics are non-specific amplifiers. So you don't, unlike say an opiate, you don't take the psychedelic to feel good. You might not feel good when you take the psychedelic. What the psychedelic does is it intensifies and amplifies what is already there. So maybe there's sadness there, or grief, or shame that you weren't conscious of before, but under the influence of the psychedelic, you now have access to it and are aware of it. And it's uncomfortable and distressing, but at least you're aware of it and conscious of it now, and you can actually feel it.
Mm-hmm.
And so that's how the medicine works. That it's really just amplifies what's already there. So, and I think people intuitively get that, but it's worth making explicit.
Yep.
Yeah.
And in that space, I appreciate where you're coming from, like this idea that there is a lot of good that can come from it, but we don't know what will come from it right out the gate.
That's right. That's right. Yeah.
If you'd like to, we do have at least 9 questions that people have been posting.
Yeah.
We can take some time to maybe engage with those, as well as a couple of people raising hands. So I'll start on the list of questions that we have. First is, there are people out there that would like to be a guide for others and try and maybe become that kind of trip sitter kind of space. Where would you recommend people start? And is it even a financially viable pursuit?
Yeah, it is. I think it is a financially viable pursuit, and more so as time goes on, and as public perception and shifts, and more research studies are being conducted, and so there's the above ground and there's the underground, and there's training available in both of those. I'm a firm believer in the importance of getting good training in supporting people in these experiences, and ethical engagement with the work. There are no comment on the underground training. That's don't have any information about that, but above ground, there is the California Institute of Integral Studies has a year-long psychedelic certificate program that's quite highly respected. And MAPS also has training in MDMA-assisted psychotherapy. Polaris Insight Center does training in ketamine-assisted psychotherapy for licensed clinicians or people working towards licensure. There's also Sage Institute in the East Bay that has a pre-doctoral, no, not pre-doctoral, it's an internship program for people who are pursuing graduate degrees. There's Fluence in New York. So there's a number of training facilities and
if you can't find one of those, you should be able to, maybe they might connect you to something closer to you. They might know.
For sure, for sure.
Okay. So there was a question about the cards that the medicine cards that you had mentioned earlier. One specifically asking about, like, if it's a tarot deck, what if a person draws something that's typically associated with negative situations, like the Tower, the Devil, the Hanged Man, or the Three of Swords? I have my own answer to that, but I'm interested in yours.
Yeah, great question. Yeah, and with the medicine card, with a good medicine deck, just like a good journey, it has all aspects of human experience. So you have some, shadow material in there, and yeah, that's draw the Death card or the Tower card. That's an opportunity to kind of like, yeah, it's showing you that there's some shadow work that needs to be done. There's something that needs to be brought to light, and so kind of like framing it in that way, as opposed to like, I mean, obviously you don't want to say, oh man, you drew a bad card or you drew the wrong card, right? You frame a that like makes sense in terms of the treatment, maybe anchoring back to the patient's intention. Oh, well, interesting, you drew this card because you had this intention of getting clarity on this particular difficult relationship, and this card is kind of maybe saying something about that.
I agree. Yeah, no, I think there's something to be said about, I think there's something to be said about leaving the framing open to the individual to some degree, but also helping guide that in a way that's not towards detrimental places, disintegration, as I might actually say.
Thank you for saying that, Ian. And that's, yeah, totally. Like tarot work is kind of like dream work in that way. Like you really want the patient to lead in how the meaning that they ascribe to it, and then not to kind of prematurely kind of make an interpretation or put your own meaning on it.
And so actually we have a question from Harvey. What about clients with poor boundaries, like borderline personality disorder? Could they have trouble since the default mode network downregulates during the trip? I think you kind of touched on this, but maybe touch on that one more time.
Yeah, that's a good question. Yeah. I think the short answer to that is that while people with personality disorders are not kind of like necessarily kind of like determined to not be a good fit for the treatment, it takes more time and effort and structure to really do the treatment successfully. And so, I work at an outpatient clinic. We don't, we have certain resources, but like in terms of like doing that level of work, I don't think that, I wouldn't feel comfortable as a clinician to do that kind of work. Some of my colleagues do. I have one colleague who really is very, very skilled at working with personality disorders, and does that work with psychedelics as well. So, but it's really should be at the clinician's discretion. And
yeah, that's a really good answer. I think it should be up to the person and the people doing the work.
Yeah.
Nicole asks, I hear/read about psychedelics being very healthy for some people with treatment-resistant depression. I found psilocybin to be healing for me, but when my depression has been at its worst and I've used psilocybin, it seems to either have a very little effect on me whatsoever, or I have a really dark trip and leave the experience feeling even more depressed. Any advice? I know that's kind of a hard thing since it's, it might be medical advice. So I don't know what you feel
Yeah,
comfortable answering in that space.
right. Yeah. I guess that what's coming up for me is just the importance of having a series of experiences, and that you're
Mm,
going, there you over that in that series you may have, let's, whatever, like 4 6 sessions over the course of like 6 months, let's
mm,
example. One of those six is going to be really, at least one is going to be really challenging, and you might be left scratching your head or feeling confused, or like, what was that about, or how do I integrate that,
mm,
um, but like, try as much as possible not to draw conclusions from that one trip and generalize to your whole condition. That have another trip, do reflect on what worked, what didn't work. uh,
mm.
do you try to optimize the set and setting and all of these things next time, and hopefully you'll have a better experience. And so yeah, I mean, yeah, try not to generalize from one experience. So
And also, I would also argue, just because psilocybin might work for low-level depression, it might not be the answer for high-level depression. I mean, you work with ketamine, you also work with MDMA. You see how these medicines need to be used in different ways.
yes,
And so I think there's some validity in saying that just because it works for something in one time or one place or one mindset doesn't mean it's going to fix everything the same way.
that's right. That's right. Great point, Ian.
Um, so I think we have maybe one or two more questions. I'll try to go through them. There are people asking about your playlists and things like that. I'm sure if they reach out to you via the website, they might be able to get some more information about those as you put them out.
Yeah, yeah.
And I have shared some links to the Polaris website as well. Cedar asks, where is the best place to access practitioner in someone's local area that are offering psychedelic therapy? Is there like a go-to resource? Or I think Maps was doing some work in this, I think.
Yeah, like, because of the illegality of most psychedelics right now, we don't have like a, basically Maps has a very general list of integration providers that on their website, and you can kind of search by state, wherever you are, you can kind of like see the providers working in that state.
Mm,
And, they're providing psychedelic integration. They're not providing psychedelic therapy because that's illegal right now.
yep.
So but yeah, that's a place to start.
And I do want to say that I am a member of what I would argue is a polysacrament church in Oakland. I will say that the most important things flanking the actual practice itself are preparation and navigation on the front end, and individual integration and community integration on the back end. Like,
Mm.
so I appreciate where you're coming from, that both of these things need to be acknowledged and worked with.
Yeah, yeah, yeah. Beautifully said.
So again, playlist questions. If a person was trying to navigate the decision for guided psilocybin or ketamine journey, what should they consider outside of legality?
Psilocybin's a longer experience, 4 to 6 hours. Ketamine's a shorter experience, 1 to 2 hours. That sometimes is a factor for people. The convenience of a shorter journey can like fit into the end of the workday, or um, you know, ketamine is a dissociative anesthetic, so it's actually not technically a psychedelic.
Mm,
Does have psychedelic features at higher doses, but it has very different effects than your traditional psychedelics like psilocybin and LSD. Um, that's another talk, but
yeah, exactly. And again, there's a lot of hope to get you to continue the conversation. It's on, I think it's Ozo. Could you maybe post the link right quick, TAM integration for us if you have that available? Because I do not. Um, I want to thank everybody again. Andy, you've been amazing. You're always amazing. Um, Eric, this has been a blessed conversation. Everybody here has been really enjoyed. There's a link in the chat if you want to try to talk to people. The ketamine unicorn Emily has provided us with has been an inspiration, almost a spirit animal for this entire talk. So thank you
Wow.
all. Thank you for this time. This has been an amazing experience. Look forward to seeing you all in the next talks.
Thank you, everyone.